Welcome to Savita and English Cast in Anatomy. We are going to learn about the orbit. It's a pair of pyramidal cavities on each side of the nose. It contains the eyeballs, the muscles, vessels, and nerves related to the eyeballs, the lacrimal apparatus, and fat. It measures around 5 to 8 centimeters in depth. In the base, it measures around 4 centimeters both vertically and transversely. The features present in the orbit, it's got an apex, a base, a roof, a medial wall and a lateral wall, and a floor. This picture shows the various bones forming the walls of the orbit and the fissures present in them. Moving on to the apex of the orbit, the apex is where all four walls meet. It has the optic canal which transmits the optic nerve and the ophthalmic artery. The base is got quadrangular in shape. The superior orbital margin is formed by the frontal bone. It's marked by the superior orbital foramen or notch, which transmits the superior orbital nerves and vessels. The medial orbital margin is formed by the medial end of the superior orbital margin and the frontal process of the maxilla. The lateral orbital margin is formed by the zygomatic process of the frontal bone and the frontal process of the zygomatic bone. The inferior orbital margin is formed by the maxilla and the zygomatic. Moving on to the roof of the orbit is formed by the orbital plate of the frontal bone and the inferior surface of the lesser wing of sphenoid. It's characterized by the presence of lacrimal fossa in the lateral part, which has the lacrimal gland and the trochlear spine. The trochlear spine has got the fibrocartilaginous pulley of the superior oblique muscle. The floor of the orbit is formed by the orbital surface of the maxilla, the orbital surface of the zygomatic bone, and the orbital process of palatine. The infraorbital groove or canal is seen in the floor, which transmits the infraorbital nerves and vessels. The nasolacrimal canal is seen on the medial end, which got the upper opening transmits the nasolacrimal duct. More medial to it, we can see the origin of the inferior oblique muscle. Moving on to the medial wall is quadrangular in shape. It's formed from before backwards with the frontal process of maxilla, the lacrimal bone, the orbital plate of labyrinthine of ethmoid, and the body of sphenoid. In the frontal process of maxilla, we can see the anterior lacrimal crest, which is attachment to medial palpebral ligament, lacrimal fascia, and origin of the orbicularis oculi muscle. Behind, in the lacrimal bone, we have the posterior lacrimal crest, which has attachments of the lacrimal fascia and the lacrimal head of orbicularis oculi. Between these two, we have the lacrimal groove, which houses the lacrimal sac and the nasolacrimal duct. Near the meeting point of the ethmoid and the frontal bone, we have the anterior and the posterior ethmoidal foramen, which transmits the anterior and posterior ethmoidal nerves and vessels from the orbit to the anterior cranial cavity. The lateral wall is formed by the orbital surface of the greater wing of sphenoid and the orbital surface of the zygomatic bone. Near the superior orbital fissure, we have a tubercle for the common tendinous ring, and in the zygomatic bone, we have the zygomatic orbital foramen, which transmit the zygomatic facial and the zygomatic temporal nerves and vessels. These are the features in the walls of the orbit. Moving on to the fissures, we have two fissures, the superior orbital fissure between the greater wing and the lesser wing of sphenoid, and the inferior orbital fissure between the greater wing and the maxilla. The superior orbital fissure connects the orbit to the middle cranial cavity, and the inferior orbital fissure will connect the orbit to the infratemporal fossa. Superior orbital fissure. The common tendinous ring divides this fissure into three compartments. Through the lateral compartment, we have the trochlear nerve, the frontal and the lacrimal divisions of ophthalmic divisions of trigeminal, recurrent meningeal branch of ophthalmic artery, and the superior ophthalmic vein. Through the tendinous ring, we have the upper and lower divisions of the oculomotor nerve, the abducens nerve, and nasociliary branch of ophthalmic division of trigeminal. Through the medial compartment, we have the inferior ophthalmic vein. Moving on to the inferior orbital fissure, it transmits the maxillary nerve, the zygomatic nerve, the infraorbital vessels, and an emissary vein connecting your inferior ophthalmic veins to the pterygoid plexus. Thank you.